All right, so I'm hoping that this will, as accurately as possible, demonstrate venipuncture for you for the lab that's upcoming. These are the arms. They've just had new tubing placed in them, and so it's even kind of easy to kind of trace where it might be beneficial to stick this patient, but they should be relatively similar to what you would see anatomically on a regular patient. We've collected everything else that we're going to need for our venipuncture, so we have our prescription, which tells us exactly which vacutainers we need in terms of what laboratory values we're obtaining for our patient. We have some alcohol rub, we have a Band-Aid, we have our gloves, we have our safety needle, which is actually going to insert into our adapter. We'll go through that in just a moment. And we have our tourniquet. So first you're walking in, you're introducing yourself to your patient. I hear that you are here for some laboratory studies today, and your patient will say yes. And one thing I like to ask is if they have a hand preference or if they've had veins on one side or the other be accessed easier. Some patients will say they always are able to hit me on this side or the other. Typically that's the patient who has blood drawn either frequently or tends to donate blood very frequently. So once you have essentially introduced yourself to your patient, identify that they're there for blood, even prior to cleansing this off with alcohol, it's okay to just kind of go through and palpate in the antecubital fossa. Even on these models, you can palpate down into the hand, so you'd be going on the extensor surface of the hand. Certainly we don't go on the palmar surface. Really what you're looking for either with venipuncture or with IV placement is where are you anatomically away from kind of nerve and more important structures that could be injured if the procedure was not done correctly. So most people will palpate and kind of get a sense of where they want to go and maybe one landmark, if not a backup landmark, even prior to prepping their patient. Other things that you can do before you put your gloves on is you can actually assemble your needle with your adapter. So this comes with two sides. So the side that has the protective device on it is always going to be essentially your needle that you're going to obtain your specimen with. The other side actually, oopsie, let's not do it that way. Obviously this one's been opened before. Opens up and it will have a little stopper. Now the stopper actually gets screwed into your adapter, okay? And then into this is where you will eventually put in your vacutainers. This then becomes an entire device which will get thrown away. So all of this then goes into the sharps because in theory all of this was accessed with the patient's blood. So that's the adapter that you can go ahead and connect, lie it down. Again, hopefully this did not come off. It shouldn't have. Certainly don't recap your needles as I just did. Now once we have that vein kind of situated exactly where we want it to be, most people will go ahead and place a tourniquet on their patient. And for those of you who've never even put a tourniquet on before, let's kind of talk through that for just a moment. You don't need to tie a knot. We're not wrapping a present, okay? We need to ensure that we could quickly get the tourniquet off, and we only have one hand because we're still going to be using the vacutainer to obtain that blood supply. So we'll practice this on each other tomorrow because it's kind of difficult on these because of course there's no extra weight to hold it down, but you really want to stretch the tourniquet out. And I'm going to kind of do it without stretching it because it's just me here. Stretch it out. You're going to fold it over, okay? And then you want to essentially just create enough tension and you just want to pop the loop up or down. So if you pop it and you make it up, again, I didn't pull this completely through. Alternatively, some people like to have it be the other way, have the half bow be the other way, but you do want some tension. Take your index finger, slide that through, and just leave it essentially as a loop. I'm going to kind of exaggerate it here, just as a little loop. Again, you want to be about, 3 to 4 centimeters above wherever your insertion point is going to be. It's kind of a rule of thumb that you could be too close, but not necessarily too far away. Now, the nice thing is when you're done with this, you simply have to pull this tab, which you can do with one hand. And because you haven't pulled it through and tied a knot, number one, you have better resistance here. Number two, in terms of causing this vein to engorge and bulk up, but it just becomes easy just to pull this tab and kind of pop it, tourniquet comes off. Now, I would ask my patient to simply make a fist. Again, we are out of the habit of asking the patient to squeeze their hand. Lowering this to gravity, it's going to help engorge the veins as well. And at this point, you can go ahead and put on your gloves. You can take your alcohol. Again, we've got the 2-minute timer. Someone probably is timing me at home. And we're going to wipe away. And if you always are concerned that you maybe, contaminated the area, or if you're just concerned about hygiene for the patient, not a problem to go right back in the same area and do it again, just making sure that you're using a separate alcohol swab. So we're gonna let that area dry. And as it's drying, again, we've already assembled our needle with our adapter. And what you'll see people do quite often is go ahead and essentially get one of the tubes ready, meaning that you cannot puncture it with your adapter. If you do so, you have lost the vacuum in your vacutainer. And so you'll stick it in and you'll wonder, hey, how come I'm not obtaining any blood? It's because you have essentially lost the vacuum within the vacutainer. Now again, very important, bevel up. You'll see a lot of people go ahead and pull the protective device away, simply because sometimes it becomes cumbersome. It's like right in your way. Now, I am left-hand dominant, so I'm going to take my right hand and I like to use my thumb and basically kind of pull down on the vein. And here's to hoping. I just put new tubing in these bad boys that this is actually going to work. And so I'm going to stick it in. I think that should be about it. Grab your vacutainer, the moment of truth. Well, that was air. So it looks like I went through and through on the vein. Now, if this happens to you and you didn't get anything, you can't just readjust. On a patient, you could actually readjust. Okay, now I readjusted and I've got some fluid there, okay? On this, you cannot, because this is not real. It only has air in it. So if in theory this filled all the way, I'd take this out, mix it a couple times, set it down. Maybe with readjustment I did a better job with the second one. I did. We're filling up. I've got my gauze. I'm gonna pop my tourniquet. Now this is where it's important, because as that last tube is filling, you can just pop your tourniquet off. That way you know you released it. Take your tube out. Go ahead and mix it a couple of times. Grab your gauze, a 2x2 or a 4x4, whichever you have handy. Put it over your venipuncture site, and in one quick motion, pull out, okay? Again, this similar to injections. This shouldn't be a very delayed process in terms of pulling that needle out. Now, if you're done using this, you're going to lock your safety device, and it's gonna all go in the sharps container. For the purposes of this, that this was not a real person, I'm gonna go ahead and recap that needle, but again, don't do what I do all the time. Then, now that I know that my patient's okay, I'm gonna go ahead and put a Band-Aid on them. If this was an older adult, I would keep the gauze on and then typically wrap this with Coban, just so that they don't have to worry about having any type of tape to their skin. Not so much about the risk for any allergies, but more so the risk for skin tears for that patient. All of my specimens are going to immediately be marked. They're gonna have the patient's name, date of birth, time of collection, and then all of this with regard to your vacutainers, all of them that you have is gonna go to the lab so that all of your laboratory values can be run. Tomorrow we will go through starting an IV, and we will also go through spiking a bag in terms of starting an IV fluids on your patient. But these models are already ready, set out. We've got 3 of them. Special shout out to Sarah, who helped me set them up today. And we'll have lab tomorrow.